Yes, my name's David Sandoe and I'm a lay person in the prostate cancer world, but I'm a survivor of 13 years. I prefer to call myself a cured person. And to put something back, because I appreciated the early detection of my cancer, I've become quite an advocate in the prostate cancer area. I'm currently the Deputy Chairman of the Prostate Cancer Foundation of Australia, and with my wife Pam, we lead the Sydney Adventist Hospital Prostate Cancer Support Group, which is one of the biggest support groups in Australia.
Can you talk to us about the current status of testing and early diagnosis of prostate cancer in Australia and New Zealand? What do you see as the differences between North America and Australian attitudes?
It's interesting, the PSA debate and the testing debate is the same in Australia and New Zealand as it is elsewhere in America and in Europe. There is a lot of controversy about it. But from our point of view, in the Prostate Cancer Foundation of Australia, we want men to go and talk to their doctor about their health, which includes looking at prostate cancer. And we suggest that a PSA test, which is in the normal suite of blood tests, and a digital rectal examination for people at age 50 and over is a reasonable thing for a man to consider, understanding that that man needs to really discuss in full with his doctor what the side effects are, etc. It's really important that if there's a family history of prostate cancer, that a man 40 and over should have a regular test, an annual test. But we encourage the debate about screening or testing. We don't talk about screening because we realise that that's not getting anyone anywhere. What we do is we spend our time encouraging men to go and talk to their doctor about their health, and that includes talking about prostate cancer.
You have a clear perspective on the importance of patients becoming their own advocates with respect to prostate cancer management. Can you summarize the key points for us?
It's really important that men that are diagnosed with prostate cancer become their own advocates and really understand the disease, because it is very complicated. That's why there's so much controversy about it. And to do that, you really must do your homework and become very self-assured as to exactly what prostate cancer is all about. And that means that you really need to talk to qualified people and people who have been through the experience and understand exactly what you're in for when you're contemplating taking a treatment option for the eradication or control of prostate cancer.
What is the current attitude to active surveillance and other forms of expectant management in Australia? Is the urology community really on board with this for men with relatively low-risk disease?
There's been a lot of controversy about over-testing of men for prostate cancer, and what we used to call watchful waiting, now called, more often than not, active surveillance, has become much more prevalent for low-grade cancers. And yes, whilst there might have been a case and there was a situation where there was a over-treatment of prostate cancer, in our part of the world, more and more active surveillance for low-grade cancers is apparent, and people are taking this option with the view of keeping an eye on their PSA at a regular, on a regular basis, and they think and feel comfortable with that option. It's becoming more and more prevalent now, and I would say that the argument for over-treatment is waning.
Here in the USA, one of the clear priorities is seen to be the development of a diagnostic test that would clearly differentiate between histologically evident but indolent disease and clinically significant disease. Do you see that as a global priority?
I think it is a global priority to come up with the best possible test to differentiate between a high-grade prostate cancer and a low-grade. And whilst we should be very thankful that the PSA test is out there, there are obviously better tests in the future, and as part of the Prostate Cancer Foundation of Australia's plank into research, we put quite a lot of money into the researchers' areas so that a better diagnostic test is found sooner rather than later. But it's got to be said that the PSA test is the envy of other cancer streams. If they had a PSA in other cancer streams, they would be much better off than what they are. So in the meantime, the PSA test, along with a digital rectal examination, is doing the job. But obviously there is scope for a better marker.
As a member of the Worldwide Prostate Cancer Coalition, can you give us your thoughts on this organization? Have there been any notable successes of this coalition as yet? What are the goals of this organization?
The Worldwide Prostate Cancer Coalition started with people from the UK, Ireland, Europe, Canada, America, New Zealand and Australia. And these are like-minded people trying to make sure that we don't reinvent the wheel and we take the best of all worlds and make sure that we get that to our consumers in our own countries. Already there's been some success with the cooperation between the different organisations, and it gives us a lot of confidence that when we really get the Worldwide Prostate Cancer Coalition firing, life will be a lot easier for all of us. There have been some very good signs with the collaboration so far, and it's times like this when we visit other countries that we get more inspired to make a better process for the Worldwide Prostate Cancer Coalition. There's been one example from an Australian point of view that we're very happy about. We've got a book that we promote, and that's What Women Should Know About Prostate Cancer. And that's the sort of example that can be taken right across the world, and other countries don't really have to reinvent the wheel. If we concentrated on what we did well and do well and shared that information, we'd have a much better understanding of the prostate cancer treatment options and availability of information for the people that need it to help eradicate this really hideous disease.